Wrinkles after facelift. We don't want them. We don't want them. We have to realize, though, that we're taking all this tissue and moving it up here. And as you migrate it up here, this area right here is where we can see these wrinkles. So the incisions are frequently placed like that. That's the best way to hide these scars. But the problem is that is migrating everything up here, and we can have these wrinkles here. The solution in the past has been to extend the incision up this way. I try to avoid that. In my hands, I find that this scar is noticeable, and once you make a scar, it's there and you can't get rid of it. So we want to avoid a scar in front of the sideburn. So what is it that I do to address this? Well, there are two things. The first is to carry the incision in the hairline up here like this, and then all this can shift up this way. And so you wind up removing only about 8 millimeters of tissue. And with doing that, you're able to pleat out all of those little wrinkles there. This is the post-op patient, and we've made these little incisions here. Again, we try not to come here. By extending this incision up this way, I'm able to move this back a little bit and pleat out these tiny little creases that happen when you rotate the tissue up this way. If you can draw it up this way, you can alleviate those concerns. The other option could be to add in an endoscopic brow lift at the same time. So we make a little incision up here, and with the incision up here, what you're able to do is go down and dissect all this tissue and lift it up that way. These are the two vectors that you can use to alleviate that little extra skin that you get when you draw up the facelift. If you can figure out how to geometrically remove that and soften that out, you can provide a more superior facelift. I hope you found this helpful. Again, wrinkles after a facelift, we don't want them. Thanks so much.